According to UPMC, respiratory cases in children and young adults are unusually high for this time of year. Newswatch 16's Chris Keating stopped by UPMC Williamsport to speak with a pediatrician about how to keep your young ones healthy.
Across the country, respiratory illnesses among children and young adults are on the rise. Hospitals are seeing more and more sick children by the day.
We're seeing a lot of rhinovirus, enterovirus that's making kids pretty sick, which actually we saw the enterovirus about 8 years ago now, and which caused a lot of sickness in kids, and we're seeing that same strain kind of making a comeback this year too.
Dr. Ashley Pence is a pediatrician at UPMC Williamsport. She says the number of respiratory cases is unusually high for this time of the year.
Viruses mutate, they change. We've learned a lot about that over the past couple of years, so there's just some years where they're a little bit more potent than other years. And so I think that's definitely a reason why, and we just happen to be having a bad year this year.
Medical professionals say the rise in respiratory illness cases, as well as possible flu and COVID outbreaks, could put a significant strain on healthcare systems heading into the colder months.
It basically burdens our healthcare system. So we want to make sure that, try to call your primary care doctor first. And that way we can really decide which kids need to go to the ER, need to be seen, and then, so that we're using all of the inpatient beds appropriately.
Dr. Pence encourages parents to monitor their child's symptoms. Here are some tips she shared for your kids.
So things that you can do is wash hands. If your kiddo is sick and they go to daycare or they go to school, if they're, otherwise, if they don't need to go to school, then I would keep them home and just until they're kind of feeling better.
She also suggested getting your children vaccinated for both the flu and COVID before the winter. Chris Keating, Newswatch 16, Williamsport.